Okay, so welcome to another session of Pulp Nonfiction. Today I have with me Dr. David Alfaro, prosthodontist extraordinaire. I've known you for a few years. You got your undergrad dental degree at New York, Columbia?
Columbia.
In New York. Yeah, Columbia
Yes.
University in New York. And then you
hmm
came to the University of British Columbia and got your prosthodontics
Exactly.
degree,
hmm
and then they released you on to the public.
They sure did.
Yes, and you worked for a little bit in Vancouver, and then you came to your senses and moved to the nicer part of British Columbia, where your wife grew up, I believe.
Exactly. Yeah, she grew up in Trail, and we're out in Nelson, BC now, which is about 50 minutes from Trail.
Perfect,
Yeah.
perfect. Okay, well, the topic on everyone's mind at the moment is the coronavirus and
hmm
COVID-19. And so I want to speak to you specifically in regards to that. But first off, tell people a little bit more about the David Alfaro that I know so well.
Sure. Hi, guys. So I'm a Vancouver guy. I grew up in the West End, went to high school out in Richmond. My parents and my family still live in Richmond. I'm asking them to be careful during this time of year. Yeah, I did an undergraduate degree in kinesiology at Simon Fraser, and I actually studied music for a long time, and then went back to Simon Fraser, finished my degree. And I was one of those people that didn't get into school in Canada for dentistry, so I got accepted in New York at Columbia. I honestly went there because the address was on Broadway. And I was like, oh, I'm going to be on Broadway. And I had no idea what a wonderful opportunity that was. Columbia is, to me, really one of the top dental institutions in the world. I really got introduced to specialty dentistry there right from day one. And that's why I decided to go into a specialty. And fortunately, when I graduated, UBC had expanded their programs and they had a prosthodontics programs. And I was one of the first in the first class with John Ng and Angela Wong, and did 3 years of hard time there, and finished up and started working in Vancouver with Dr. Bridger, worked with him for a couple of years, and then we decided to part ways. I ended up your way in Richmond,
Yes.
and I practiced in Richmond for almost 5 years. And then just an opportunity arose to move to the Kootenays, where Melanie is originally from, and Mel's a orthodontist, and we met in residency. And it was a tough sacrifice. We both had practices and we had a place in Vancouver, but this was an opportunity that we wanted to take, and we did it. And looking back, we're really, really glad that we did it, because we are safe and sound in our home here in Nelson, BC.
And how's the skiing in Nelson?
Really, really good. This was a bit of a down season. Like we go over to Roslyn to Red, because Mel's family's been skiing there for decades, and it's got a lot of terrain. I'm a beginner. I'm not as advanced of a skier as you are. And so, but ski season started slow this year. We didn't really get out there over Christmas, and then now things are shut down, even though it's still snowing up there.
Yeah, craziness,
But
craziness.
for good reason, for good reason. There isn't much community spread here yet, but they've been proactive and they shut everything down.
Yes, no, absolutely. And I think the atmosphere out there is people are ready for more restrictions, because if you weigh up the pros and the cons, it's not a tough pill to swallow.
People are prepared.
Yes.
People are prepared. I think here in our area, where we don't have that many cases in the community, and in the interior health, which is from like Kelowna all the way to the Alberta border, we don't have that many cases. I think we can, if we take these measures, we can flatten the curve, as they say, and hopefully weather the storm and our hospitals don't get hit so hard. But we'll see. It takes people being responsible and actually believing the experts. There's a lot of
Yes.
skeptics.
Yes. No. Yeah, you're absolutely right. So, starting off, what have you done to protect David Alfaro and Melanie?
And Alexandra, we've got a
And Alexandra, sorry.
month-old
I should have started off with Alexandra,
Yeah,
and then Melanie, and then
well, the first thing is we took things seriously right from the beginning.
Yeah.
I was keeping an eye on things for World Health Organization and the province, and so we're following the recommendations. We're practicing social distancing as much as possible. We try to order things to the house, and then we have like a triage where we wipe everything down and leave the packages outside for a period of time to let them decontaminate. I know it's neurotic, but we're doing it. And when it's actually time to get out there and go get something, I feel like I'm in an episode of The Walking Dead going to do a supply run. And I've been limiting, so we split up the tasks. I go out and do that, and Melanie stays home with the baby. And we're lucky we're in a place that there hasn't been that much community spread, so it's still relatively safe. And we're also lucky that we're in an era where we can do stuff like this. We're having a communication face-to-face, and it helps you not feel so lonely, and it helps you keep in touch with your family. I've spent more time face-to-face with my family over these couple of weeks than I have in the past months. There are some positive things coming out of it.
Yeah, can you imagine we had this in the 80s?
I couldn't. Like, we didn't even have call waiting. Like, the phone would be just like beep, beep.
Yes.
Yeah.
Yeah. And it'd be playing a lot of music and reading a lot of books.
Mm-hmm.
It's not necessarily bad, but different. But yeah, so you protect yourself and your family. That's great. And did you share your approach with your staff?
Well, absolutely. Like, the best thing I could have done for my staff was to close my office.
Yes.
Like I said, I was tracking the World Health Organization and the cases here in BC. And as soon as the WHO declared this a pandemic, and as soon as we started seeing community spread in BC, before even we got the warning about the PDC and all these things and the strong recommendations for us to go to urgent and emergent care, I called my team and I said, look, this is a concern for me. I don't want to put you guys at risk, and we're shutting down. We're shutting down entirely. And on Monday, we were shutting down the office, and that's when we were watching the news and saw that we're all supposed to be on quarantine and this and that. And so we were ahead of the game. We were already doing that.
Mm-hmm.
And even though, like, we're in a small community, we're on a small community where there's not that much risk of spread yet, but I wanted to be proactive and make sure that I protected them. And since then, I've been the only one in the office. Like, I'm here right now doing, like, calling patients, letting them know, like, our appointments are canceled, doing some accounting, and wrapping up all the operatories.
Yeah.
I did have to don a collared shirt. You got me out of my pajamas.
Yeah.
And aside from that, once the dust settles, I wanted to assure them that, granted that my business survives this closure, that they have jobs here. They have their jobs here. And I put together one of those sub-Ps, a supplemental unemployment benefit plan for them. It's not much. It's what I could muster together during this time of closure, but I think it's the right thing to do.
Mm-hmm. Mm-hmm. Now, specifically, have you come across some dental emergencies?
Well, I would say I've come across dental urgencies.
Yes.
No true emergencies as defined by the college. Like, fortunately, we are in an active community, lots of biking and running and skiing. And so there's no shortage of people with fractured jaws and fractured teeth and true injuries. But fortunately, people understand that they're not really in a situation where medical care is running 100%. So people have been careful. Most of the concerns that I've had at the office have been, my temporary fell off, or I've got a sore tooth. And the good thing is that most of that can be managed without face-to-face intervention until it gets a little more serious. So I'm hoping we get a little direction from the college in the next now, so I know how to properly manage those situations if the situation arises that they do have to come into my office and I do need to see them, because we're totally closed. Nobody's coming in here.
Right. So if you had a situation where someone had a dental emergency, and let's say an abscess, do you have someone you can send to, or would you then bring the person in? Didn't respond to medications, and your concern is going to develop in a fascial space involvement, the nightmare case.
Well, in that situation, yes, I would have to bring them into the office and see them and try to manage things without doing aerosols. And the tricky thing is right now, like, how do we do an open and drain without creating an aerosol?
Mhm.
How can we guarantee that we do an extraction and then it doesn't turn into a surgical extraction and we got to bust out the handpiece? And
Mhm.
so that is a concern. Right now, we are fortunate that just 4 minutes from my office, the hospital is there and they are equipped with 2 dental operatories, but
Oh,
that would be me passing the buck to somebody else and passing it on to the emergency department. And I have spoken to the local dentist who has hospital privileges to see, okay, well, how can I, because I had, and when I was in Vancouver, I worked at VGH, how can I transfer my hospital privileges over from Vancouver Coastal to Interior Health? Can we fast track this? Because it did take quite a while to get those hospital privileges in Vancouver. So, if the situation arises where we do need to see somebody, that we see them, that I can see them in the hospital and, you know, help out instead of just passing the buck. But that's still kind of us working things out grassroots level. We haven't heard anything official from the Interior Health or the people in charge of the hospital.
yeah. Yeah, no, absolutely. It's the silence is deafening, isn't it?
It's really difficult. It's really difficult. Like, this is the time for the college to step up and give us some guidelines. The college has been restructured to improve uh, transparency and to help promote public safety. And here we are, a community, 1,000 dental offices strong, and dental assistants and dental hygienists, and all that we know is the definition of an emergency and urgency and a non-essential care, which helps. It's a good start, but I want to know how I have to protect my team and my patients before I start bringing people in to provide some care. So hopefully until then, antibiotics and painkillers get us through until they have enough time to give us some more direction.
Yeah. Yes, no, absolutely. And how many offices are there in Nelson?
Nelson, for a small community, I think we only have like 15,000 people. There's quite a few offices. I think there's close to 10 practices. Like if you're downtown Nelson on Baker Street, there's an office on every corner. But Nelson is a bit of a hub where we provide community services to a whole bunch of smaller towns of, like, 6 to 8,000 people that don't have dentists there and don't have specific healthcare providers. So Nelson is a bit of a hub for the local community. There's a lot of professionals in the area. We've got a great community, and a lot of the dentists are part-timers that would rather be skiing or out on the lake and work 1 or 2 days a week. And then there's, a handful of I would say, younger dentists like myself that are doing the full-time 4-day-a-week Kootenay life, which is great.
That counts as full time, eh?
Yeah, 4 days a week.
Your Vancouver days are
4 hours,
behind
7
you.
o'clock to 2 o'clock. It's great.
Wow, beautiful. Now, are the dentists in Nelson chatting amongst each other?
We have a great community even before this. And, when you're a specialist moving into a community that never's had a specialist, there's Dr. Bibby Orthodontics. So she's been here for a long time and took over an existing orthodontic practice. But other than that, there's no specialists in the area that are here full time. I was a little concerned, like, are the guys and gals that do implants going to be concerned that they got a prosthodontist coming to town? And like, it's a competitive market everywhere. But I was welcomed with open arms, and we've got such a strong community. As soon as things started getting a little more complicated, we were communicating. And we were chatting, like, okay, what are we going to do? We really should look at how to centralize care. And we started a petition together that we sent to Interior Health, and that kind of took off and made it all the way across the country. And even now we're calling each other and emailing each other, like, okay, we've got this emergency, what's going on, how is the best way to handle it? Because we don't have any guidance from above. So like as a local community, we've been really strong in supporting each other during this tough time. I think we're going to come out closer.
Excellent. Excellent. Well, full points for effort in these trying times. It's things are changing hourly.
They sure are.
And so we won't hold you to these 5 recommendations. This time next week, they're going to be redundant. But if you had to give 5 recommendations to fellow rural dentists, what would be David's top 5 list?
Well, number one is to spend time with your family. We're always so busy. We're always working so hard. Dentistry is a hard, competitive game right now, all over North America, really, and we're always so busy. And now I've got some kind of mandated time off, and this has been amazing for me. We had a baby 5 months ago, and I couldn't take parental leave. She was born on Sunday morning, and I was here in the office Monday morning and went back to the hospital, slept there, and right back here Tuesday morning. And now I've got all of the time in the world to be with them, and we're really making the most of it. I just hope that they don't get tired of me because I'm really, really enjoying this time.
Yes.
Number 2, I would say stick together. And like I said, like we're so lucky here in the Kootenays. We've got a really, really strong community, and we all support each other, even though, we're technically also competitors, but we're not. We're colleagues, and we're assets to each other. And we've been really supportive of each other throughout this whole thing. And I think we're going to get through this even on the plus side, on the other side of it. Number 3, I'd say just don't risk it. We're in small communities, and word travels fast. And if you're not taking the precautions to be as safe as possible for your staff and your patients and yourself, people are going to find out, and you don't want to risk, first of all, putting anybody in danger for something like a temporary crown falling off, or something that like a chipped tooth. We've got to be a little more diligent at what we really deem emergencies to be.
Okay.
Number 4, I'd say support your local businesses. As small businesses and small communities, we're integral to the economy locally. And when I moved to the area, I wanted to inject myself into the local community, and I supported different community projects, and I shop locally, and I try to support, like the local alarm company and the local gardener, and so on and so forth. And even though our businesses might be shut down, we can support the local supermarkets and the local farmers and the local people that are still functioning and still working to help us through these times.
Okay.
And number 5, I just got to say, share positive messages. Right now, Facebook and the WhatsApp groups and the media, it's just full of just like sad, horrible news. And yes, we're in a crisis. It's horrible, but we need to start spreading the positive messages, the happy messages, and happy photos and happy stories, and really help boost the morale of our communities.
Combat the negative mental health aspects of all that we're going through.
It's tough, and a lot of people are stuck at home, and fortunately for Melanie and I, we've got a beautiful home and a beautiful yard, and we're in a neighborhood where we can go outside and be like 100 feet from the next human, but not everybody has that opportunity, and they're quite close together. Like my colleagues in New York, they're going through a really hard time, and they can't, like, as hard as you try in New York, it's really hard to social isolate. But with the modern technology that we have, we can get out there and try to spread positive messages to each other.
What? Yes, definitely. So your colleagues in New York, how would perhaps you had your 5 tips for rural dentists. What 5 things from your colleagues in New York do you think are positive responses they've done to this virus? Because their world is so much different, and you're familiar with that world, but you can compare and contrast to.
Yeah, I've caught up with my classmates and my friends that are living in New York, but more so to check in on them and see how they're doing. Like how, like you said, like how's their mental health? Like just like how are you doing? How are you coping through this? How are your families? In terms of the business side of things, yeah, they've all been proactive and they've all shut down. And they've taken the same recommendations that we have here, and they've also been really proactive there. And just like here, myself and Dr. Bibby and Dr. Koshev and a couple of the other doctors, we got together and we got all our gloves and our masks and some N95s and gowns and toothbrushes and toothpaste and everything we could possibly muster. And we drove it up to the hospital and dropped it off for the people that are on the front lines fighting, like fighting real emergency and saving lives. And my colleagues in the States have done the same. They've shut down their offices and they're putting together drives to help the medical professionals that are putting their own lives at risk to save the lives of others.
Mm-hmm. Mm-hmm. As a prosthodontist and speaking to general dentists, and they have perhaps patients who are halfway in the midst of maybe a bridge prep or a few crowns, any insights or recommendations for that? Like we have, as went through dental school, we have X amount of time with a temporary crown and then you're in no man's land. um, what happens if we get into no man's land? Like it's been 3 months of the temporary.
Well, that's a real tough one.
Yeah.
And that's a situation that in my own office I am dealing with. I was just on the phone with somebody for 20 minutes, and I know it's in retrospect. I spend a lot of time on my temporaries. My temporaries are supposed to be a mock-up of the future crown. Those things fit, they seal the tooth, they have retention, they're the appropriate dimensions, they're contoured properly, the contacts are good. And so that's critical. And some people may not spend the time on their temporaries, and then it's too late for this now, obviously. But moving forward, hopefully we don't get in a pandemic again, but there's a reason for really providing someone with a properly designed temporary. Now, even the best temporary, if you're doing a gold restoration on a 7 on the mandible, that's going to break. That's going to fall off, and that's the situation where it'd be nice to have some guidelines from the college, because it's really hard to have somebody come in and provisionalize them again without creating an aerosol. And fortunately, my situations, and this isn't medical legal advice, but I've ordered some of those just individual packages of temp cement, and I'm gonna stick it on my door and say, hey, come here, just mix it up, put a little bit in there and pop it back in there. And then once we have guidelines from the college onto, okay, this is the proper screening, this is the proper protective equipment, maybe we can start moving towards actually securing these restorations. But right now we're in limbo.
Yes, and pardon my prejudice, but my understanding with prosthodontic practices that you will perhaps have some people who are less able to cope with a non-dental emergency, and it might feel as an emergency to them. And in that
Yes,
situation where they're
that's
pushing hard, and Dr. Alfaro, I'm dying here, and you got to save me, and you know that they're not dying, but
yeah, that's a very well phrased statement, and it is one of the realities of being a prosthodontist, is that quite often we aren't treating complicated cases, we're treating complicated patients. But this is where we have to be strong and inform our patients, like, look, I understand that your tooth might be sensitive and it might be uncomfortable, or there might be a sharp edge, but you coming into the office, we can't guarantee that that is safe right now. And if you become a point of contact for transmission of this virus, we can put somebody else in serious risk for their life. And we're going to put perhaps a healthcare worker at the hospital at risk of their lives. And so we have to just make some sacrifices right now individually. And if we have a chipped tooth that's irritating your tongue, that's not a dental emergency. A dental emergency is you're bleeding from the mouth and we can't control it. or you have a swelling that is compromising your airway. And a missing temporary is unfortunately not a dental emergency. And most of my patients have been very, very, very good at to understanding that. And in fact, have been sympathetic of what we're going through and understand like this is a big deal, shutting down a dental practice indefinitely. Especially
Yeah.
what I moved into.
Yeah. Yeah. In all honesty, I am pleasantly surprised that patients appear to be very good at self-policing and self-regulating. And so the one concern is hopefully that the public are not overcompensating, but they certainly don't seem to be undercompensating, that we're not getting those people. The rules apply to everyone but me and you.
Right.
They're gonna fix my tooth. And you're like,
Exactly. I'm not going to tell anybody. Don't worry. Like, no,
yeah.
I'm sorry. The
Yeah.
doors are shut.
Yeah. Yeah. And the other with your scenario there is, okay, Mr. Jones, we come in, we treat you, you get sick, you're in that hospital bed. What about that poor young fellow who's in a car accident? Right?
Sorry, that's my office phone. I don't know how to.
Yes. No, it's all right. We'll
pause this, or is that
yes,
work?
yeah, we'll pause it. Pause it. I'll pause.
It's still going on Monday. I'm going to be making all those calls myself on Saturday, just letting everybody know, like, hey, because we had informed a 2-week block of patients saying, okay, we're closed, we don't know how long, and now it's time for me to just call everybody else on the schedule, 6-8 weeks out, and let them know, like, hey, we're closed. And I'm going to do that myself because it's my responsibility, as I want my patients to hear it from me, and they really appreciate when I'm the one that's calling them and they hear my voice, and I let them know what precautions we're doing to protect them. Because when we reopen, I want them to know that I took every single precaution to keep this office as clean and healthy as possible, that my team as healthy as possible, and everybody in the community as healthy as possible. So it's important.
Yes. Yes. No, absolutely. So, screening patients. Anything in particular you're bringing to the table when you're chatting?
I'm directing everybody to my website, primarily because when the news first came out about the PDC, I have my cell phone number on the overnight for emergencies, like we all should. And I was getting phone calls till 11 o'clock at night, and just like I spent the first 3 or 4 days just on the phone answering questions. Yes, we went to the PDC. Yes, we did this. Yes, we did that. And no, we're fine. And people asking me to go get tested, and insisting that I post the results publicly, and just like, so I was proactive. I said, you know what? I'm going to modify my website, and all that information is on my website. So the splash page of my website, the first thing they open, it's got all the current information from our practice. It's got all the current information from the BC Dental Association, from the College of Dental Surgeons, from the Interior Health. I've got links to cute puppies and kittens so people can see some fun things too. And I've been making infographics and videos informing people of what's going on to really help provide them information. And then my email's there. That's the first point of contact that I prefer, because that way we have written documentation of the communication that I could enter in the patient chart. And then if it's a true dental emergency, they can call me on my cell phone. But like a true dental emergency is uncontrolled bleeding, a broken jaw. Those, I'm sorry, are going to have to go to the hospital. I don't usually treat those in my office anyways. The cellulitis, yes, we'll address that in the office. I'll have them take pictures, teledentistry. Okay, send me some pictures. Do you have any swelling? Where's the swelling going? And if it's at risk of compromising the airway, unfortunately, they've got to go to the hospital. And I know it's not the time to overload the hospital. In terms of screening specifically for the virus, I'm waiting for guidelines from the college. Like, I am not an expert in communicable diseases. I didn't do a hospital-based residency. I did a graduate program. And I don't feel that it's appropriate for me to be screening patients because I don't know if that's a valid instrument. And I will be operating on the assumption that everybody is a potential carrier and a potential point of contact in the virus in the office. And so that means that everybody that comes into the office, we would have to be prepared with full PPE. And I'm not ready to do that at the office until we have guidelines. And I don't even know if I'm ready to do that for a sore tooth when all of that equipment should be going to the hospital, because that equipment might save someone's life or a healthcare worker's life and prevent that healthcare worker from going home or going somewhere else and spreading it to somewhere else. Like for me, we fix teeth. Like I'm not going to put people's lives at risk for a sore tooth.
We've entered an age where maybe a tooth that we would consider a tragedy to lose is going to be lost.
Right. And that's a lot better than having a potential loss of other people's lives. So
yes. Yes.
But I'm waiting
It
for
kills us to say that. The oral
So-
surgeons will love it.
Yeah, we'll see how it goes. And then the way that I'm managing patients right now is teledentistry as much as possible. I'm not putting any codes into, like, I think I'm not doing any billing or anything like that. It's just email me pictures. It'd be nice to know what the PIPA requirements are of this and what the implications are, the Personal Information Protection Act, because it's not ideal to have patients taking pictures of themselves and sending it to us via our personal emails, but that's what we have to do right now until something is centralized, like use this system to communicate with your patients. But until then, I'm just taking as much of a history as possible and getting them to take the best photos and being as conservative as possible in the pharmacological approach, yes. And then following up with them. I'm emailing these people every day, and the reality is they don't get back to me right away, so they're not so concerned. And the refractory patients are the tough ones, like 5 or 7 days out from now, if I have somebody who is not responding to antibiotics and not responding to painkillers, what's the next step? And so I'm really hoping we get some direction from the college or the Ministry of Health before these cases get into that point where they're truly refractory.
Yes. If we can band together, the dentists can really prevent more strain on the medical system, which
I'm really proud, like when you're talking about banding together, I'm really proud of how our local dental community has stepped up. Not just here, but in Vancouver, all over the place. In Kelowna, we have people that have stepped up and said, you know what, we're ready for this. We were prepared for this. We're trained for this. Mm-hmm. And the BCDA is helping put together information for the rest of us dentists to see, okay, like who's prepared for this? Where can we send our emergencies if we don't feel comfortable seeing them in our offices? Like my office is 3 totally open operatories, and we don't know how this aerosol travels. We don't know how long it's in the air. I don't know what I need to do to the immediate environment once somebody's in here. Can I see one person, then I gotta shut down the whole thing and wipe the whole clinic down? The vents go, I live here. I live upstairs. And like I know it's neurotic, but we don't know, and we haven't been given the instructions from the college. So it's been awesome. I commend everybody who's out there banding together. So, sometimes we're competitors, but it's awesome to see that everybody's getting together and sharing resources and working as a team here, because I feel we're getting let down, and it's nice for people to step up.
Yes, the foot soldiers are leading the battle at the moment, and hopefully, everyone will be in a better position as we collect more information and gather things. And we certainly know that perhaps the people in organized dentistry are doing their darndest to come out with things, and we're just really wanting to come out with it right away. So it's not that anyone's thinking that they're not doing it. We're just like, figured it out yesterday.
Well, I'm happy with the BC Dental Association's efforts. They've had a little lag, but now they've really stepped up, and we're getting those town halls, and we're getting information, and they're trying to give us information about PPE and how to handle things. Where they're really helping out is like, how do we manage our patient, our staff, like EI, this kind of stuff? Because those are questions I have no idea about any of this. And so that's been really helpful. And they're doing what they can for practice guidelines, but we need to hear it from the regulators and the Ministry of Health. And
Absolutely.
there yet.
Yes. Yes. Well, it's been a fantastic discussion, David. I enjoyed
Thank you
it.
for having me. This is a really great idea.
Yeah.
I hope more people participate. It's a great way for us to keep connected and talk about the issues at hand.
Yes, and it'll probably be a few days before this is up, and we will get some questions and some comments, and we'll pass on those questions and comments to respond to, and there may be call for another one.
Sure.
Yes.
Well, my schedule's cleared up. I'm calling patients right now, canceling appointments, so I've got all the time in the world.
Yes. Yes. That's perfect. If I can get you out of changing diapers, I'll do that.
You got me on my pajamas. That is a big victory. I did my hair. Quarantine coif.
There we go. Yeah, it's looking good. Well, it's lovely chatting to you, David, and I wish you the best of luck. Let's stay in touch, and thank you so much for this. This is wonderful.
Thanks, Joel. It's really awesome, and it's good to see that you're healthy and doing well. And hi to everybody out there.
Yeah.
Please be safe. Say hi to your loved ones and touch base with people that you haven't seen for a while. It's really important that we keep optimistic out there.
All the best.
Bye.
Bye-bye.